incidence of lung cancer increases with smoking. So at least for the Philippine government, they have already found ways of trying to prevent smoking in public places. There are laws now that have been passed wherein people cannot just smoke anywhere, especially in the malls or in just the regular commuting areas, like in the private in the public utility vehicles. You cannot just smoke anywhere. There are already designated smoking areas. I think that's a huge step in trying to prevent lung cancer in the Philippines. Information campaign is really very, very important. Unfortunately, right now, the need for better access to medicine is a problem. Our government has projects for other cancers. They've actually started with breast cancer prevention, still trying to move on to the other lung cancer, to the other cancers like lung cancer. But because of meager resources, we just usually have to kind of prioritize the more common cancers. But in terms of campaign, there are not a lot of lung advocacy groups in the Philippines. And like as I've mentioned, with breast cancer advocacy, they have more. The reason for that probably is lung cancer patients die earlier. They have a shorter lifespan. They only when they get diagnosed, they live like for only 6 months to 3 years at the most if they get treatment. And unfortunately, really finances are a burden. So a person who gets diagnosed with lung cancer, especially if they're in the lower income generating group, they'd rather just stay at home and just let it be. Unlike for the more affluent families, then that's the time that they can pursue treatment. And because it's diagnosed late, usually that's the problem. People don't really come for general checkups on a regular basis. People usually come when they're already symptomatic. They're feeling the difficulty of breathing already, or they're feeling the cough that's not going away, and that's the only time that they see us. But for a regular person, maybe a 40-year-old person who goes to work every day, an annual checkup is not really something that is commonly done. Okay, because it's expensive. There is some cost to it. Okay, CT scan is expensive. CT scan is quite expensive. So we still have out-of-pocket expenses. So the regular checkups are not shouldered by the government yet. There's no government insurance that will really cover for the usual routine checkups. The government insurance is more of what do you call this, for times when you're already admitted in the hospital, but not really for outpatient screening procedures there. We don't really have screening for these kinds of cancers. Well, in terms of availability of drugs, we have the more common drugs. We have the usual chemotherapeutic drugs. We already have on hand the targeted agents, but again, they are quite expensive. In terms of the newer generation drugs, the immunotherapeutic drugs, those are not available yet. At present time, they are just being launched. We just have them on clinical trials, but it will take quite a while, I think, for all the immunotherapeutic drugs to be coming into the market. So that's the little challenge. We have to import from other countries because we have to wait for them to be commercially available. Radiotherapy, they have a very good package. The Philippine health insurance system has a very good package for radiotherapy, but for chemotherapy, not yet. We have yet to develop that aspect. I think we're becoming the capital of call centers. So call centers in the Philippines are rising left and right. And it's just unfortunate that we have a lot of our younger generation who get into the call centers and they have to stay awake at night with very terrible working hours. And sometimes smoking is a way to get out. Smoking is their way to take away the stress. So we are a little afraid that because of this considered new job that has come up in the Philippines, the future we might be seeing more lung cancer cases in the women.
Right now, what is happening? Are you seeing More women.
Well, there's still more men at present time, but the call centers just came in the past 5 years. So I'm not so sure. Maybe our statistics might change in the next few years. That is the challenge. It's really a challenge to inform people. So we really have to have some form of information dissemination about prevention of lung cancers. For palliative care, again, that is really a challenge. Most patients, especially if they can afford, they would just prefer to stay in the hospital where the doctors are and the nurses are, because we don't really have groups taking care of patients at home. We don't have nursing homes yet that would take care of patients for palliative care, but we do have the pain management. We have anesthesiologists who are specialized in pain management. We can administer that. But if we consider nursing homes, we don't have them yet. So it's really, like for me, it is a challenge when I have patients who just require palliative care. It's not yet available. It's not yet available. The World No Tobacco Day, we just want to reiterate that there are a lot of factors in our environment that can cause lung cancer. Pollution in the environment is something we cannot really avoid, but for smoking, which is the #1 cause of lung cancer, we really can try our best to not just avoid smoking, but to prevent other people from smoking in front of us. Just encourage awareness that smoking will not be good for the person's health who smokes and the people around them as well. Yeah.
Thank you so much.
Thank you.